When health is compromised, there is you get to see a person vulnerable, and seeing someone at their most vulnerable state can be the most humbling thing ever.
Mm.
And that's why sometimes you hear nurses are burnt out, or they're emotionally detached, or they are. Some people have said that nurses don't have a heart because we've seen so much death. Death doesn't surprise us anymore. It's not true. Sometimes that's just compassion fatigue. And
Mm.
for a nurse
Compassion.
to fatigue, which means you've got to that point where, oh, okay, it's done. It's happened again, and you're trying to not think much about it, but at the back of your mind, it's actually there. However, your expression, your reaction is like, okay, it's done, it's done. For a nurse to get to that point, it means there's been so many unchecked emotions, so many unchecked um, looking after. I would always
Mm.
be an advocate of looking after yourself. Working in healthcare, whether as a nurse, a doctor, healthcare assistant, whoever, pharmacist, laboratory person, but majorly those that are in the front line in direct patient contact and care, the emotional toll is no joke. And
Mm.
looking after yourself should really come first, because you cannot provide care if you're drowning yourself. Sometimes
Mm.
when I lose patients, or it makes me realize how feeble life is. But
Mm.
also, I there are times where, yes, I cry. I really cry for those patients and their families, especially when I know how much they've struggled and how much they put in, how much they fought. But at the end of it, it's got to that point. But my consolation most time is the fact that I did the best I could. And if the only thing I'm able to do at the end of their life is providing comfort and presence, then that is enough. And I think that's one thing we healthcare professionals fail to realize, that there's only so much we can do.